Welcome. Thanks for joining us. Today is the start of our 3-part series on perimenopause. So in our 3-part series, we're going to have our first episode, which is going to be what is perimenopause? Our second episode, which is going to be, is it perimenopause or something else? And our third episode is going to be, what are we doing? How are we helping and treating women? Today is our first episode, which is going to be about what is perimenopause. So like so many of our listeners, I am too a woman. And I don't know a whole lot about perimenopause. I know what I've learned from Dr. Fox, and I've learned from what I kind of need to know as a clinical counselor about like the mental and emotional sides of it and how I can support women on that end. But as far as really understanding like the breakdown, the why, the how, the understanding, I also have some learning to do. So the way we're going to format today is I'm going to just learn with you from the wonderful Dr. Fox. And so we'll just have a conversation about what she knows and what I know. And hopefully by the end, we all know more than we did at the start. So let's start with you defining what is perimenopause.
Yeah, so we'll go over the classic definition, and then we'll just go over probably what the definitions should swing closer to. So classically, what most of us kind of know of is a woman starting to have irregular periods. So that asks the questions, what is an irregular period? And that would be defined as your period swinging either 5 days early or 5 days late than what you used to have kind of predictably. So if we're talking about the average cycle, let's say it's a 28-day cycle. If you had a period that was 22 days, and then the next period you had was 33 days, that would be swinging more than 5 days in either direction. So that's the classic definition of irregular periods.
And here,
Sorry.
yeah, and here it's probably good to note maybe how it's important or why it's important for women to like track their cycles. Something that you and I have thought over our whole life.
Oh gosh, yeah, she just started. But from a practitioner point of view, this is super important because honestly, majority of women, when I say like, oh, okay, like what's your average length of your cycle? Like, yeah, it's about like 30 days. And I know better now because I've been doing this for so long that I'm like, let's double check that. If they haven't started tracking it, I will get them to. And if they have, I will open up their phone and look in it. And probably 8 times out of 10, their cycles are way more irregular than what they think they are.
Mm-hmm. So track your periods.
Yes. Now, it's a good idea. As far as how we should start defining or even viewing perimenopause and its onset, it should be very different because honestly, a lot of women will have regular cycles until 2 years before full menopause. No joke. So you got 8 years of regular periods, but you feel like you're going insane that whole time, which isn't good. And so we have to start looking at this from a different lens so we can then start getting the right support in place so you don't have 8 years of your life feeling that way.
It's a long time.
It is. Yeah. So what are kind of the earliest signs of perimenopause? I would say probably the most common thing is actually having a change in your PMS symptoms. And I think this is something that you can attest to.
Yeah, big time. I can attest so strongly to this. I am in this. I'll share more with that later. But yeah, feeling like I am a very mentally unstable therapist is not the best feeling when you are a mental health care provider.
Yeah. And that is, again, going back to like time, that's 7 days of 30-day month. That's a lot of time to be spending not feeling well. Yeah. So change in PMS symptoms. So some of the more common things that women will start to notice is whether it's drop in mood, increased anxiety, insomnia, night sweats, which can come out of nowhere. They might even find that in that phase, they get some vaginal dryness, genital urinary symptoms, such as like getting up in the middle of the night and having to pee. So just like changes in that 7-day window, anything that's happening then that wasn't happening before can be a sign of the beginnings of shift in your hormones and therefore early onset, or not early onset, but perimenopause.
And this is what like I've experienced and I'll hear a lot in my office as women will be like, I don't know why, but like I hate my husband. And now that I've gone through this, I can be like, oh man, I hear you, sister. But I think that's where I think sometimes therapists too, it's like, oh, well, there must be something happening in your marriage. But that's where it's so important for all kind of aligned health professionals to understand, like, what are the symptoms of perimenopause and how do we get women into the right spot with the right care practitioner? Because dropping someone into marriage counseling if they hate their husband, but it's just actually a sign of perimenopause, probably isn't the way.
No.
Okay, so tell us a little bit about age and how long we expect this journey to last.
Yeah, so there's a spectrum, obviously. I think that we often talk about 40s being kind of classically when someone starts to notice shifts, but it can actually be as early as age 35. If it's any earlier than age 35, that's where we actually have to consider other health issues that could be going on and that you should get worked up for. So 35 and earlier is typically or later is typically what we're looking at. And then as far as how long this journey lasts for, it's about 10 years. So if you go into peri around age 40, then you could expect to lose your period by age 50. The actual average age of full-on menopause, which is you haven't had a period for a year, would be age 51.
Which is sort of wild. This is a decade of time that all women will go through in different ways, that there's still just like so much misunderstanding about our own like lived experience as women. That's a wild amount of time.
Yeah, it really is. And that's why we're doing this.
Correct.
Yeah.
So let's talk about some of the whys there. So why is there still so much confusion about a 10-year long process? So let's talk next about like the list of symptoms. I think because there's so much confusion on this, I think it's important to break down what are all the pieces so that we can all understand how to kind of spot this faster and more effectively.
Okay, so when she said list of symptoms, I'm legit going to read a list of symptoms because it is so long and I do not want to miss a symptom and then therefore miss someone in thinking that they're not actually going through perimenopause. So I'm actually going to go through this categorically as from like systems in the body to kind of condense it and make it a bit more categorized. But here we go. So central nervous system meaning like symptoms rooted in your brain. So anxiety, depression, migraine headaches, difficulty falling asleep or staying asleep, brain fog, difficulty with recall. This is huge. Like this is so, so big for women in peri. You know, at work, all of a sudden you're not performing the way that you used to. So a very big complaint as far as why women end up treating their perimenopause. Worsening of ADHD symptoms is something that I can attest to personally. It's wild. Reduced motivation and fatigue. So that's your brain symptoms. Now, genitourinary, meaning like urinary system, so bladder. Vaginal symptoms, so vaginal dryness. Frequent urination, which we touched on. Urinary incontinence. Wow, yes, this happens. You've had the babies, your pelvic floor is blind, and then suddenly you're leaking. It happens all the time. So this is a big one, and actually one that people don't like to talk about or share with their healthcare practitioner. Another one, reduced libido. I put that in this category because it's in that region, though really it's kind of it is like a central nervous system brain kind of issue. But if you have vaginal dryness, you're obviously less likely to want to engage because it's going to be painful. And then lichen sclerosis, this is interesting in that like this is an autoimmune condition that can start in the vaginal area due to change in hormones. So though it's not necessarily caused by perimenopause, it kicks off in perimenopause. So that's just kind of a side. Yeah. And then we talked about things related to cycle lightly. So irregular cycles, we talked about that. Spotting before your period. So if you're spotting for 7 days before your period, that can be happening. Your period's actually just getting heavier or lighter. So me personally, my periods got so light where I was needing to use panty liners, and we'll get into hormonally what was going on and why. So those are some of the cycle changes that you can expect.
And that's where it can be so different because mine got so heavy that I was bleeding through my pants at work, which was, that was fun for me, but so different, right? Same age women to vastly different symptoms there.
I prefer my symptom over yours.
Correct.
As a note, heavier periods means low iron, which means you're also not going to feel good because of that. Okay, last section. This is just kind of an other section. So vasomotor / hot flashes, or even just feeling like you're more hot in general. A lot of women will say, like, I just feel like I'm just warm. I used to be the person that needed a coat in the room, and now I just feel like I need to take all my clothes off and I don't need to wear as much outside when I walk my dog. So that can be a sign. Itchy skin, change in weight distribution. And the reason why I say distribution is that I don't want to call it a myth, but a lot of women do say, it's my hormonal shifts that cause my weight gain. Your hormonal shifts do cause a shift in where you put on your weight, which is a less desirable region of your body, being that it's more abdominal and visceral, meaning like around your organs. So they feel like they're carrying belly fat, which they are. So it's shifted from their legs to their stomach. And no female would desire that. And then downstream, yes, you can become more insulin sensitive in this phase, and thus that causes more weight gain, but it's not like the hormones themselves. So it's the root cause. More on that later. Then joint pain, that's another big one. A lot of women, when they go on hormone replacement, their joint pain completely goes away. Bloating, and then I touched on just like changes in blood sugar and food cravings. So that's the big giant list.
Oof, to be a woman. What a list of things we have to experience. And we've already had to experience a full list of getting our periods. And then for those of us who have had children, going through that. And the fact that there's so much misunderstandings. I'd never heard of some of those things. And I talk to you all the time.
Yeah, no, there's a lot going on. And that's why it is so important to talk to somebody about this, like a healthcare provider that understands these symptoms, because otherwise, like I said earlier, you might get missed if they don't understand the nuances and what these hormonal shifts can do and in what part of your body. And just because you only have 2 or 3 doesn't mean that you're not from perimenopause.
Yeah. And we're going to talk about that a lot in our next episode, which is that, like, is it perimenopause or something else? Because there's so much overlap in these symptoms that I can just see so many healthcare practitioners just assuming it's this, and then women are just being treated incorrectly. So let's talk about the like hormonally. So just like kind of breaking down for us. And this is the part where I am excited to learn a bit more about like what's happening in our bodies. So we have these symptoms, we have these experiences. What's going on?
Yeah. So hormonally, the big 2 that we're going to talk about, which we could go into 1,000 different directions with rabbit holes and all the hormones that change in this phase, but we're just going to talk about estrogen and progesterone to keep things a bit simple. That doesn't mean that other hormones aren't being impacted as a result of their change. But what is classically happening in early phases of perimenopause is your progesterone typically is the first thing to start to go down. And progesterone is nice in that, like, it's just this gradual decline. The line, though it's going down over the 10 years, it's not changing. So it's consistently going down versus estrogen, on the other hand, is kind of erratic. And that's where things get really confusing. So your estrogen can actually swing from being high to then swinging low. And so your symptoms will change sometimes from month to month, or you might get 6 months of a particular set of symptoms, and then you get a whole new set the next 6. So it's unpredictable in that way. Now, some examples of different symptoms that match up with particular hormones. So as far as genitourinary things go, so vaginal dryness, urinary frequency, and I actually didn't touch on this, and I should have, because it's very important. Increase UTIs, so urinary tract infections. This is huge. And actually, look, there's a huge amount of research out now actually talking about the fact that a lot of women die as a result of frequent UTIs because they've never been treated with hormone replacement therapy.
Say more. Women die?
Yeah, there's a lot of research showing statistically, if women had been treated with even something as simple as a vaginal estriol cream, that their UTIs could have been prevented, and then therefore the death related to those infections could be prevented.
Wow.
Yeah. I digress. So back to symptoms. So estrogen symptoms, we're talking about the urinary symptoms, so vaginal dryness, urinary frequency, bladder infections, brain fog, heavier periods. And I say this loosely because it's complicated. If progesterone is going down and estrogen's going up, periods can get heavier. But if just progesterone on its own is going down, but estrogen staying the same, you can still get heavier periods. So this is confusing. So again, work with a healthcare provider who can suss this out for you. Brain fog is another low estrogen symptom. So I would say those are kind of like the top ones in that category. And then as far as progesterone goes, that would be insomnia, increased anxiety, just more mental health stuff. And that's because progesterone is a very calming hormone. It helps to soothe and calm the nervous system. And so that's why those are so big with progesterone going down. And then hot flashes is kind of even between the two. It's the imbalance between estrogen and progesterone that kind of cause hot flashes overall.
Yeah, so like listing all of these symptoms and like helping us understand the why. Because also, you must see such an emotional impact of this on women. Like you're experiencing brain fog, wondering if you're just like losing it a bit. You hate everyone. You have vaginal dryness. You're just angry. Like it's such a complicated thing to be going through and to be figuring out who you are and all that. Hey?
Yeah, definitely. And not only is it hard for you, but it's the people around you too, because they too feel it and they too notice it. And as far as like women who are in marriages, like it becomes complicated where one partner's libido has not changed and the other has, or maybe she's experiencing pain because of her hormonal shifts. There's a breakdown there, especially if there isn't good communication. Problems can start.
Absolutely.
Yeah.
Yeah. So let's talk about kind of a good bridge from this to how difficult it is for women to be experiencing all this. A little bit more about like, why is there still so much confusion? We're talking about a decade like long experience, and yet there's still so much misunderstanding about what this all means. Can you kind of help break that down for us a little bit?
Yes, I can. I believe that, if we're starting off just looking at generational differences. So my mom didn't talk about it. I knew that she ran in and out of the house often when I was a teenager. I didn't know what she was doing. She talked about being hot, but nothing was ever explained to me as far as like what stage of life she was in, what was going on. I don't even think she knew what was going on because her mom never told her. So I think that as far as like how we're raised and our parents' own education or just societally what we knew and what we know is that it's just not been something that's been talked about. And therefore, no information has been passed down to different generations about what it means, what's happening, and how to handle it.
Yeah, absolutely. And I think the part that I know, even though I don't know a lot about this, is just like the systematic minimizing of women, like the patriarchy as a whole. I feel like if a man goes into a doctor's office and he's like, I'm experiencing like erectile dysfunction, there's this like red button and the doctor presses it and people rush in. Whereas if a woman is like, I'm really struggling with my libido or I feel higher anxiety, they don't care because you're just a woman, or it's just sloughed off as like, here's an SSRI and like kind of like, you're obviously not handling things well. So the just whole like society that we live in and how we treat women as a whole must play a massive role into how this like huge life phase doesn't seem to have a lot of understanding around it.
No, it for sure doesn't. And that's part of the issue when it comes to the actual like medical training. So GPs being trained and how much information they've been provided in their education as far as like, again, going back to definition of what is perimenopause. Women coming in with a lot of these symptoms who had regular periods are getting shut down even today. Like the news is out, everybody knows, and yet there's still GPs practicing so archaically and either saying this is just a normal part of life, you just need to go through it, or because they have a regular cycle still, they're like, there's something else going on, or just ignore them completely and send them other way and say, we ran your labs, blood work is fine, you're normal, everything's fine.
And I think that like how we talked about before, how there's this like internalizing of the system where then we start to gaslight ourselves and we're like, okay, well, the problem's me. I'm obviously just not handling all of the demands of life well enough. And then we start seeing like another layer of like self-worth and inadequacy building on top of an already, I mean, that symptom list was a double pager. So if we're internalizing that as something wrong with us, like that's even more detrimental to women.
Yeah, and that's a big thing is a lot of women think I'm not a good wife, I'm not a good mom, you know what I mean? And they start to feel so insecure that they then do seek support, whether it is through an alternative, which I don't consider myself alternative, but I am to some people. So I'm their alternative, their backup to their GP because they're just not getting heard. Or they're going to counseling because they think something's wrong with them. Like they think they're the problem causing these issues.
Which is why it's so important for practitioners, all practitioners, medical doctors, counselors to understand this, because this was not part of my graduate training of like, what is perimenopause and how to differentiate a woman coming in with marital issues, that has actual marital issues versus she's just in perimenopause and needs to see someone like the wonderful Dr. Fox. That's going to be a lot of resources spent and time and stuff just trying to figure out why she's so mad. Yeah.
Yes, 100%. Yeah, I was going to say I had a patient even just last week who came in about reduced libido. And although we know that the issue is her hormones, it brought up a bigger issue in that like her partner not acknowledging or understanding or believing that that's what it was. And so this is above and beyond what I can support people with, right? Like there's bigger issues at hand when it comes to communication and trust and all those other things. So yes, I can give her the hormones, but that's not going to fix the breakdown in the other piece of the relationship. So,
well, and I think sometimes with changes allows women to kind of maybe even reassess themselves in their relationships. If you find that you have a partner who has no tolerance for a shift in libido, exactly, that's going to open up maybe more of an awareness of a deeper issue. Yeah, it's a complex one.
It is, definitely. Now, a few other things when it comes to why this phase is so confusing. Another would be is that a lot of women are waiting till later in life to have babies. Not that there is anything wrong with that at all, but it does just muddy the pot in that, like, if you have a baby at age 38 or 40, when potentially you're already in perimenopause, you have this baby, then you're struggling. I mean, yes, you need to get worked up for postpartum depression, but sometimes it's hormonal shifts, but it's not the hormones that your doctor's trying to say, like, oh, you just had a baby, this is normal, this is part of it. It could be too that you're going through peri while breastfeeding and raising this like small human and exhausted and tired from not sleeping. It's just terrible.
Yeah.
Terrible time.
Yeah, that would be a terrible time. And I think talking about like the cultural things that are just different now culturally, like 50 years ago, women were having children so much earlier. So, yeah.
It just didn't come up as much. Lastly, I would say that the confusion is then, too, if we're looking at something like really concrete, is that even in drug monographs, and I say drug, even hormone replacement therapy is considered a drug, though it's like we're using identical to your own hormones. Those monographs list very specific guidelines, dosing, contraindications, etc., which has made a lot of women feel that treatment isn't meant for them because, again, of how we've defined in research, even though it's not even founded in research anymore, but they're just like late in the game to change and update these actual things that kind of put some doctors in handcuffs from being able to use hormones in the way that they should.
Okay. So lots of symptoms, lots of reasons why sort of this misunderstanding's happening. I know there's definitely things that I am learning in this conversation, as I hope we all are. I think as we kind of get closer to the end, maybe it's good for you to share some of your experience. So you've been working in office with women for many, many, many years. And it might be helpful for the listeners just to kind of get a bit of a peek into like a day in your life and to sort of see some of the things that you're seeing every single day with women that are coming in with that like massive list of symptoms.
Yeah, I think I've like touched on a lot of this throughout the episode, but I'll give kind of a more I don't want to say comical, but it was like this patient's kind of funny and she stands out because she's funny. But I'll use her as just like an example of what can happen when you're in perimenopause. So I had seen her a few years ago and I hadn't seen her for a while, but she came back to me because she had tried going through her GP to get hormone replacement therapy because A, she felt like she was going crazy. B, she wanted to divorce her husband. And C, these symptoms only came up in the 7 days leading up to her period. And yes, her periods were regular. So she goes to her GP and goes over the symptom list, even the timing. She was very clear with when it was all happening in relation to her cycle. And his suggestion was to go on an antipsychotic. So that's the prescription she left with, was to go on a bipolar medication. And definitely is not bipolar. But he was like, sorry, like this is a psychiatric issue. And this is how I'm going to support you. And those are your only options. And even though she requested specifically hormone replacement therapy, that was all that he was willing to do for her. So she comes into my office, explains her symptoms. We get her set up for some progesterone. So I started her on the one hormone first because we don't want to get confused if we start two things at one time, and then layered in the estrogen later. And it was wild. She no longer wanted to divorce her husband and she didn't feel like she was going crazy anymore.
Yeah, I mean, I can attest personally that it does feel like psychosis a little bit. I guess I'll share a little bit about my experience, which Dr. Fox has helped me with a lot, just because she would see her lovely best friend change dramatically 5 days before her period.
No, I think you were just telling me about what you were saying to your husband. I don't know that I was like,
We went away on the summer and I went to the Ciera has a cabin.
oh, you were crying a lot, right?
I was just out of it. It's like a zombie.
Oh,
I usually am a pretty great personality.
oh yeah, you were peppy. That's right. Okay. Oh, we're at the cabin. Okay. Yeah.
So that's a good example. And just, it did, 3-5 days before I was going period, I felt so much rage. The idea of like hitting something with my car, that like felt like it would have been awesome just to smash something. And that sounds totally like psychosis, but it definitely wasn't. And yeah, like I have a wonderful husband who I don't know if obsessed is an inappropriate word, but he's wonderful. And I really started to not like him, being short with him and my children. Nothing he said was right. He was just the dumbest, dumb man in the world. And I was just angry. And that, went on for a long time. And even though my best friend's a naturopathic doctor, and even though I do know about this stuff and I'm a mental health care practitioner, there were moments of internal gaslighting of just like, maybe all this time I just haven't seen that he's such an effing idiot. Like maybe I'm just opening my eyes, which is like, that's not right. Right. And so it's so critical that we're knowing what these symptoms are. And even when we know them, that we're not dipping into our, I think, just like internalized narrative that it like must be us, that we must be the problem. And I think we're taught that in so many ways that even like I knew all the things, but I still did internalize it a little bit. And so when I seen a naturopathic doctor and went on some progesterone, my life was so much better, so fast, because like Ciera, like Dr. Fox says, like 5 to 7 days every single month wanting to like do the murder isn't a good way to live. And like life is short and we have just such a finite amount of time here, so that if we kind of calculate what that number would be, I don't know, too high the number to feel miserable all the time. Yeah.
Yeah. So I'm going to try to trace my steps back. I have a few comments to make. So one, when she was at my cabin and she felt like a zombie, she didn't know she was in her PMS phase because she didn't track her cycles properly at that time. Yeah. So like she was walking around like out of her body. It was like an outer body experience. Like she wasn't even there. And then realized, I think it was like months later. I'm not even sure, but you like
1 month.
Well, you got your period shortly thereafter, but like she had no idea. So that's like just another like, sliding a little note about track the year cycles. And two, I can actually attest that her husband is a lovely man and she was going crazy because the hormones were changing. She was. Yeah. I can't remember. I might have had a few other comments to say, but those are kind of the bigger points with that.
Yeah. I think with kids though too, like I think in those periods, like I wasn't the best even version of a mom. And so when we talk about like the impacts of this on the whole system, you touched on that earlier. I think that's significant because I work with midwives, which I'm sure I'll talk about in this at some point, but I do see a lot of new moms. And if we're talking about, having babies later and all of those things, new moms and just moms in general, the way we treat our children sometimes really, like, if we feel like we're not treating our children ideally, that's going to make us feel terrible and something that needs to be addressed. And so that was part of that too. I was just shorter with my kids at that time. And that's terrible. That's a terrible impact of perimenopause.
Yeah. And for me personally, though, I noted on low estrogen for myself particularly, one of the reasons, because low estrogen is going to hit everybody, but it hit me even harder. And I don't think it's a coincidence that I actually got diagnosed with ADHD in this last year, around the same time that my hormones were actually more significantly starting to dip, which honestly made my job and functioning in my day-to-day life at work feel overwhelming and insurmountable. It was just too much. My recall as I'm sitting here, hosting these, appointments back to back to back to back to back, and my ability to recall and to stay focused and to engage and do all the things and get the information I need to kind of suss out what's going on with someone, my brain just wasn't firing properly and I couldn't focus. Everything was kind of blurry anyways. So those with ADHD, when your estrogen goes down, your natural production of dopamine and serotonin, for that matter, also dips. And this is phasic. As we noted, your hormones basically change. Not basically, but through perimenopause, your hormones are going to change. But even within your, let's say, 28-day cycle, your hormones change. But I was noting that my ADHD symptoms were the worst when my estrogen was lower in whatever phase of my cycle I was in. So yeah, that's another piece. It's good to understand. And that's my personal experience so far.
Yeah, absolutely. And until you figure that out, it's really easy to be like, oh, I'm just not handling my life as well. Right?
Yeah.
Okay. So we've talked about a lot of things today, shared some of our personal kind of experiences with this, and learned a lot, hopefully, from Dr. Fox. Our next episode is going to be about, is it perimenopause or something else? So breaking down just all of the other things that can overlap with it, and that it's not usually just one thing. And then after that, we're going to talk about treatment, which is also really important.
Yeah, stay tuned.
Thanks for listening.
See ya.
This podcast is for informational purposes only and does not constitute medical or mental health advice. We're not your doctor or your counselor. Please contact your own healthcare providers before you make any changes to your health and wellness protocols related to your body and mind.